Do people who experience homelessness use emergency medical services at a high rate?
Yes, they do. But again, I think this is really interesting because I feel like I would do that too. So the great thing about okay, so the bad thing is when you go to Emerge, you have to wait forever, but it's really one-stop shopping. So, when you go to a sort of a regular setting, somebody's like, oh, go here for blood work, go here for an x-ray. I'm going to refer you to a specialist across town. And which you might wait 6 months to go see the specialist. Or you could go to Emerge and yeah, you might have to wait 12 hours, but like maybe you don't have anything else to do anyway. So you're sitting there, but then you get to be seen by your specialist, you get the x-ray done and you get the blood work done all in one place. And somebody can see you that day, which is what you're looking for. So I understand, I think, why people use the ER, but they do tend to use it at higher rates for sure.
Mm-hmm, mm-hmm. And then we find that we have a certain contingent of folks that won't go in. Our research study in City of Kawartha Lakes looking at use of ER, people would say to us, I'd rather be dead than go in there because of their experience of how they've been treated. And so then things get worse and worse. They're waiting till that appendix bursts rather than going in to be treated poorly and to have that kind of stigma. Have you done any research at all around these sort of these Zoom clinics in pharmacies at all? It's probably not a downtown Toronto thing, but we certainly in the rural areas. Lindsay has a pharmacy where you can go in and see someone as like a primary care urgent visit. I don't know if you've done anything.
I haven't done any research, but I've seen it. Actually, I went to my own pharmacy and I was like, what's that low room? And he's like, oh, they do virtual visits there. I was like, oh, that's kind of cool. And at Covenant House, we don't do we do phone visits. But I don't know of any research like specifically for people experiencing homelessness. I will tell you sort of anecdotally, our young people do find it convenient if you already have a relationship with someone. Nicole talked about relationship. It's almost impossible. No one's interested in talking to you over the phone for the first time. It's just awkward, or even like virtually. They don't want you maybe necessarily to see where they live and just know about their business. So I find if you already have a relationship, then I think the virtual stuff can work, but I don't think it's good for establishing relationships.
No, we found a little bit, and again, anecdotally, that there were mental health visits often. And I can't imagine. I mean, we had a few folks say it was great because it was quick and I could get there and, I didn't have to go too far. And on the other hand, we had people saying it just felt like I was a piece of meat. I'm seeing this psychiatrist on the phone or on I think it was telehealth actually, or some kind of Skype or something that they were using. And they don't know me and I don't know them. And, so it's interesting to see how that, because especially post-COVID now, with all of us getting really comfortable with this remote stuff, I think it's kind of a good thing and a bad thing, maybe. Like you don't want to overuse it, right? But anyway.
I think it's like, we often say this in the homelessness sector, there's no one size fits all approach. So I think it might work for some, but I think we're also learning the importance of all these little interactions that we have throughout our day that are actually turned out they were really important. Like, they talk about the water cooler conversation, but just these informal conversations that we have all kind of missed for the last year and a half. So back to like a primary care setting, I think it's not just being seen for your need. If it's a good clinic, it's like chatting with the nurses or chatting with whoever, grabbing yourself a coffee. It's just that whole thing. It's not just your need. And when it's virtual, it's just focused on your need.